Hello, guys. How we all doing? Happy Sunday. I know it's already midnight somewhere right now. Here is 2:52. I know it's midnight in the UAE. It's evening in Cameroon, West Africa. So this is Mr. John once again. On MJA Healthcare Consulting, we talk about Nclex. We talk about nursing. We talk about opportunities working abroad. We talk about schooling, study, and work abroad. That's what we do on this channel. If you're new, please like, comment, share, and make sure you listen, watch our videos, and make good use of them. So today, I want us to talk about the Nclex new generation. We've been talking about Nclex, but the section I want to talk right now is about the case study. And I will be giving you some tips on how to prepare and answer case study questions in the Nclex new generation properly. The first thing for you to be able to tackle this section of the Nclex, I will advise you to make sure you have a mastery of the content. What do I mean by content? When you prepare, when you review your Nclex materials, you have to make sure that you read along the line. When you read, for example, a medical condition, let's say a GIT condition, what I advise is make sure you can be able to come out with similarities and differences of some of these conditions. Remember, most of the GIT conditions will have similar signs and symptoms. Most of the respiratory conditions will have similar signs and symptoms. Most of the cardiovascular and so on. So what makes you to be able to distinguish that this is for this condition and not for this is what we call differential diagnosis. You should be able to come out with differential signs and symptoms peculiar to particular conditions. Another way to come out with a differential diagnosis is you should be able to come out with a lab result. When they give you lab values, you should be able to match and say this lab value is high, is low, is particular, is significant to this condition and not this condition. From the health history, you should be able to say this history is directing me to this condition. For example, we're talking about GIT. Let's make mention of the dumping syndrome and hiatal hernia. We know about this, right? These are GIT conditions. Now, what makes you to be able to know that your nursing care in dumping syndrome will be for you to let your patient lie down after eating? And for hiatal hernia, let a patient sit upright after eating. If you are able to distinguish this, you are already a high percentage high being able to pinpoint that this is for this. What happens in case scenario questions is that they give you the history, everything. The patient comes with complaints of this, and the first question they ask you as a nurse, what do you think this patient is likely suffering from? And the next question will follow from the lab values, and somewhere they ask you your nursing care. And if you're not able to pick out your diagnosis, your nursing care will not go, because they will give you a nursing care like select all that apply in the options, and the options have answers that are connected to everything in the case study. But when you are able to know that this is a dumping syndrome in your nursing care, you will be able to pick the option that says let the patient lie down after eating and not let the patient sit up after eating, right? The second to know that is dumping. The word dumping, say dump everything, dump it down. So that's where you know that the patient has to lie down. Hiatal hernia. head of bed. Increase the head of the H. HH. So that's how you know. So healthy hernia, raise head of bed. So let the patient sit after eating. Let's take a second example. Myocardial infarction and angina. How are you able to distinguish that this is not an angina, this is a myocardial infarction? Let's say in the case scenario, and they mentioned that the patient takes nitroglycerin, we know what it does, right? And the patient did not get relief after taking nitroglycerin. Then you should know that this is a myocardial condition because the nitroglycerin was not enough to dilate the blood vessel and increase blood circulation. What if they say the patient was relieved after rest? That is angina, right? And they move further to say the EKG was done and there was a non-STEMI or a STEMI. So you should be able, in the case scenario, they will give you the lab, they will give you the history taken and everything. What I'm trying to say in this video is that when you read, make a table, come out, bring out medical conditions that look similar and bring out their signs and symptoms. Let's look at peripheral arterial disease conditions and vascular disease conditions. Now, when you know that in peripheral arterial disease conditions, when you know the direction of blood flow goes down the arteries, they supply the extremities, right? But in vascular disease conditions, blood flow goes up to the heart. So one of the nursing care that you should know is that in peripheral arterial diseases, you do not raise the legs above the heart. Instead, you do that in vascular disease because why? You want blood flow to the heart because that is the direction of flow. But in peripheral arterial disease, the direction of flow is to the extremities. So the legs should instead be in dependent position, or do not raise the legs above the position of the heart. That's the right thing to do. By knowing your differential diagnosis, peculiar things, simple things, this will make you stand out in answering case study questions in the new generation Nclex. Thank you guys. See you in the next video.